Hello, I'm Dr. Sridhama Banerjee. Today I shall be talking to you regarding white coat hypertension. So, what is this phenomenon? This is a phenomenon in which the blood pressure of the patient is increased, that is, it is greater than 140 by 90 millimeters of mercury when the patient comes to the hospital or to a doctor's clinic. But the blood pressure of the patient is normal when the patient is at home or when the patient is doing other normal day-to-day activities. That is, the patient has high blood pressure, I would say very high blood pressure, only in a doctor's chamber or in a clinic. So, what is the reason? And why is the name white coat hypertension? The name is white coat hypertension because traditionally the doctors used to wear white coats during doing treatment. So, white coat hypertension, that is when you see a person of the medical fraternity, when you see a healthcare professional, when you go to a healthcare professional's clinic, your BP, your blood pressure increases. So, you might be thinking that why? This is because the person is undergoing a stress reaction. The person is feeling anxiety or fear that what if my blood pressure tests are abnormal, what if I have increased BP, what if the doctor suggests any diagnostic test and it comes to be abnormal, what is going to happen in that case. And this anxiety builds up subconsciously, it releases adrenaline and builds up fight or flight response, that is the sympathetic nervous system is activated, but this is a totally subconscious process, the patient has no control over it. So this is white coat hypertension. So how can you diagnose white coat hypertension? So first of all, when you come to a doctor and the very first time you see that your BP is extremely high in a doctor's chamber, however you know that at home it is normal, so the very first time the doctor will not prescribe any medicines based on only one BP reading. So what the doctor will suggest is home BP monitoring. So what is that? You have to keep a BP machine at home and you have to measure blood pressure at home in a relaxed state. Like when you're doing normal activities at home in relaxed state, you measure your blood pressure at frequent intervals and at regular intervals over a span of several days. So if that comes to be normal and if the average reading of those various BP readings comes out to be normal, then you don't have blood pressure as such, you only have white coat hypertension. And another thing that the doctor will suggest is ambulatory blood pressure monitoring. This is that you have a device attached to your body and this device keeps on monitoring your blood pressure over a 24-hour span at frequent intervals, say at around interval of 30 minutes and or at an interval of 1 hour. So this device will give a reading of several BP readings over a span of 24 hours, and when you make an average of that, if that comes out to be normal, then you have only white coat hypertension. That is, your BP is otherwise normal, but it increases only when you are in the presence of a healthcare professional at his or her clinic and you don't have hypertension per se. So this is white coat hypertension. I thought that it's important that you become aware of this condition because we see frequent cases of white coat hypertension and really it's a big distressing condition for the patient. So that's all for today and I'll meet you again in my next video. Till then, stay healthy, stay happy, bye bye.